Hi, I'm Michael Marin. At Holy Name Medical Center, we believe that all citizens need to be informed about the important healthcare issues that affect their daily lives. That's why we're proud to support programming produced by the CAUCUS Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, Holy Name Medical Center in Teaneck, New Jersey. Healing begins here. Suez, ready for the resource revolution.
QUALCARE, Inc., a managed care company administering health plans that care about your health care.
Choose New Jersey. Our mission is attracting companies to the Garden State. NJ Best, New Jersey's 529 college savings plan. Turn a dream into a degree. And by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No. People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Welcome to One-on-One. I'm Steve Adubato. It's our honor to introduce Professor Elizabeth Haines, Professor of Psychology at William Paterson University, and the lead author of a study called The Times Are A-Changing, Gender Stereotypes, published in the Journal of Psychology of Women Quarterly. Good to see you, Doctor.
Thank you. Thank you for having me.
And the focus of the study is?
Gender stereotypes.
Okay, now we were saying right before we got on the air that there's a difference between gender stereotypes and?
Gender differences.
Break it down for us.
Okay, gender differences are the actual differences between men and women in terms of different psychological traits or physical characteristics, and gender stereotypes are the perceptions of the differences between men and women.
What do we know about the stereotypes? What do we find?
Well, we had a data set from 1983, and we collected new data, and we showed that the gender stereotypes have not changed over these years, which was a little surprising to us. We looked at gender stereotypical traits, which are communal and warm and versus agentic and powerful. Role behaviors like tends the house, takes care of the children, and breadwinning, physical characteristics, and then occupations as well. And remain consistent, actually a little stronger in today's data than in before. So
we're taping right after Hillary Clinton has been nominated as the first woman to represent a major party, to get the nomination from a major party for the presidency. Is it relevant to this discussion?
Of course.
Because, how so?
Yeah, well, a lot of people think that just because a few people have broken the barriers regarding gender or race with Obama, that the whole category has changed or that it's gotten better for everyone, and that's simply not the case. So just because a couple make it through the glass ceiling doesn't mean that the whole group has changed. So of course, Hillary is oftentimes brought out, oh, gender stereotypes have changed, but the majority of women are still underrepresented in Congress and the House of Representatives, and also in business and leadership. They represent, about 12 to 13% of higher level leadership positions in organizations. And so it's still not commensurate with the 50% of women who are in the workforce right now.
Why have you said, Doctor, that if Donald Trump, and again, this show will be seen for many months, even after the election, why have you said if Donald Trump were a woman, finish the sentence?
He would be even more laughable than he already is.
But we're supposed to be being scholarly and academic.
Yeah.
Is that not a political statement?
A little bit.
But where's the scholarly part, from the research?
Oh, well, so think about this. So if Trump was, Donna Trump rather than Donald Trump, and it was, Bill, not Bill, but a male, Clinton, not Bill. Not Bill. But, when people say these things as a gender person, you perceive them differently. There's a shifting standard in terms of, so, think about when we call Hillary ambitious. That's seen as a negative. When Trump does it, it's very positive. So the same behaviors that we apply to men and women get evaluated differently as a function of the person that are saying them.
Gender bias, how dangerous?
It's automatic, unconscious. We oftentimes don't even know that we're doing it. A lot of our data shows that women are just as sexist and as biased as our men. Which is
that true?
Absolutely.
Women toward women?
Yep. Yeah, so because it's a cognitive bias. So my basic thing is that if you have a brain, you're biased. You use information categorically in very simplistic ways because we try to understand people very simply and very quickly and don't take into account all of the information that they're giving us.
And so people who insist, I'm totally objective, I'm not biased, they don't even know, they're not aware.
Yeah, it's actually, we have a term for it. It's called bias blind spot, and everyone has it. And we're very quick to point out and understand other people's biases and how those operate, but we have kind of an inability to see our own. Oftentimes because it happens so quickly, automatically, we often make excuses for it as well. We don't understand that it's happening. So yeah, we have a lot of bias blind spots.
So what I'm curious about is where all this comes from, and I'm sure it comes from a variety of factors. So I grew up in a very, let's say, traditional Italian-American environment. That means different things to different people. But let's just say where I grew up, there were not a lot of strong, my mother was an incredibly strong woman, but in a very traditional Italian-American culture, and where my father was the dominant figure in the home. How much of how we see gender is based on how we grew up and what we saw?
It does play a factor and a role. Those are our internal working models about how men and women should behave and how they relate to one another. So as you were saying, your mom had a lot of power and strength, but it was a domain that was gender specific. It was the home, it was the house. She got to decorate and decide what to eat and so forth. Those are oftentimes low status things in the larger culture of the world. And your dad probably was a breadwinner, and those are high status things, and those where he had his sphere of influence. And we do tend to play out these things, especially when we choose our families our own, you know. We know that gender stereotypes get very strong when people have young children because they're so stressed out and time is limited, and so you just fall back on it. Gender stereotypes are like kind of comfortable schemas that, you know, when we don't have time to think, we just kind of fall back on them. And so the way that we grew up is kind of built into what we fall back on.
But you don't think that's changing, you know, and forget about what you think, because your research is what it is. So our daughter is very young right now, and we have two sons, and I have an older son from my first marriage. And I'm convinced that our daughter, who is, you know, 5 as we do this program, is incredibly strong and very much heard. And it is, my point is that I believe that she's being raised differently because of these times. Am I wrong?
Well, one thing that we do know from the data is that women and girls have changed a lot more than boys and men have.
Than perceptions.
No, their actual behavior has changed, and the gender stereotypes have changed. So it's much more acceptable for a girl to be powerful, confident, athletic after Title IX than it was 30 years ago. So the gender stereotypes for women have changed a little bit more than the ones for men. Men haven't taken on the caregiving, the nurturing roles, you know, so as much as women have taken on the kind of confident, dominant, breadwinning roles that are also really lauded in American society. Those are high status things that we love when people do them.
Do you have any recommendations as to what we could and should be doing to improve things? Or is it just here are the findings?
We try to let people know that these exist and to try to people to catch their biases. Like I said, there's a bias blind spot.
How do we know if we don't know?
Yeah, well, letting people know about them, giving them tricks to little kind of if then, like, oh, you know, am I using gender as I perceive this person is a really important, you know. So one thing that I always tell people is that, you know, if you're kind of taken aback by someone's gender atypical behavior, you know, think about why that's bothering you, or would that behavior bother you if it was done by someone of the typical gender, you know, and really assess those and do some analysis. Yeah,
I need to ask you this as a student of leadership myself. Fascinated by it. Do you believe that men and women and the way they lead is significantly different based on gender?
Yeah, Alice Egley has done a lot of research on this. Lots of meta-analysis that shows that it isn't. There are very similarities that, you know, because once you get into power, it's power that predicts your behavior, not your gender per se. And as powered people, we act in dominant, confident leadership kinds of ways.
Power corrupts, and power corrupts absolutely.
Right, exactly, yeah. So
and you don't think it's any different based on gender?
The behavior is different. It's the reactions of the subordinates that change, you know. So women have to be a lot nicer, a lot more communal in order to be effective. It's the damned if you do, damned if you don't dilemma. So, you know, in order to be powerful and lead, you need to be strong, you need to be confident, but that oftentimes receives a lot of backlash from subordinates because women aren't supposed to be. They're supposed to be nice. They're supposed to be kind. They're supposed to be concerned with other people's goals. And when you're a leader, you're more concerned kind of with your goals and your group's goals, but it creates a conflict. So men can get away with a lot more as a leader than women.
Men can get away with more as leaders?
Oh, absolutely.
Really?
Yeah. Because they don't have to be seen as warm.
But so you're saying all men are not as warm as I am, as leaders. I just want to clarify that.
Yeah, well, you're just an exception to the rule.
Was that the point you were trying to make?
Of course, yeah, that was exactly the point.
Everyone in the control room has just literally fallen off their chairs. Our camera guys, I'm joking. Do you mind if I tell everyone again?
Yeah.
What the research is, you are the lead, Dr. Haines is the lead author of The Times They Are Changing or Not, a study on gender stereotypes published in the Journal of Psychology of Women Quarterly. Thank you so much. Dr. Elizabeth Haines, thanks. Stay right there. We'll be right back right after this.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD and follow us on Twitter at Steve Adubato.
We are pleased to welcome two very special guests, Maria McKeon, Vice President of Mary's Place by the Sea, and her colleague Michele Gannon, President of Mary's Place by the Sea. Welcome.
Thank you. It's great to be here.
Mary's Place by the Sea is?
It's a cancer center for women who are in treatment or up to 1 year post-treatment.
Created in 2009 because?
We saw there was a need. Michele was sick with a flu and saw me at the gym and said, I had this idea, Maria, do you want to join me? And I said, yes, I'm with you. And it was to help people with a terminal illness get away from it all. And we really started to create this mission based on a conversation with each other about when a woman has a life-threatening disease or any kind of experience that they need help, and cancer being one of those things that we thought of, their house, their laundry list, they're always doing everything, and to take a step away and to really heal themselves from this experience. And that's really how we started to create this mission, really just with each other kind of brainstorming, and the puzzles of the piece of the puzzle started really coming and forging together.
You know, we have some friends who have actually been there and spent some time there, and they talk beyond the services about the love and support and the empathy and compassion. Talk about some of the actual help that is provided.
All of the services were actually created because of sitting with the guests and asking them, where are their gaps? Where do you need support? What can we do? And we found resoundingly that it was the emotional support that they needed. So we started with oncology massage because that's a service that quiets them. We take them into the massage room. We have licensed practitioners who just give them a moment to, sometimes that's the first massage they've ever received, but what it does is it connects them back to their body. And then we
What do you mean by that?
Because through the medication, through the diagnosis, we have found that once diagnosed, sometimes it's outside of. It's a diagnosis, it's a screen, it's a stage, it's a cell, and you're forgetting the soul, the person it's attached to. And so what we do is we connect that person again and let them really feel. It is an emotional journey, one that must be taken, and that's taken with over 100 different volunteers. Many of them are survivors or thrivers, as they like to say, and they can sit with our guests and say, I have been down that road. I have taken that med. I have felt that way. Yes, it caused strain on my marriage. My children were suffering as well. And the emotional connection that starts to happen is where the healing begins.
And you've expanded. I mean, tell folks as we put up the site and your also Twitter information, I want people to understand the work you're doing, but also you've expanded.
Yes.
We have.
Describe it.
A beautiful home, a 10-bedroom home with their own bathrooms. We started out in a B&B, and that was just a 5-bedroom home that we rented. And then we moved to another facility that was as well a private residence, 5 bedrooms. But we saw the need and a wait list of guests that we needed to have. Yes, we are booked until January, and we needed handicap accessibility, and we needed a location, a larger kitchen. We needed a sanctuary that we could have different type of programming for us, and we like to encourage, journaling and guided imagery and different practices that we felt that would be beneficial to a person, and of course the ocean. So
By the sea.
By the sea.
That matters.
Yes.
It's healing.
It is.
By the way, the support you've gotten. John Bon Jovi.
Incredible.
Why?
What it is because for people to pick up the phone and say, we are recognizing what you're doing, and we want you to keep going. And we know you might need a little hand up. And that is what has been happening for the past 7 years. When Maria and I started the mission, we did not know where the next dollar was going to come from. But we just kept going. We kept driving forward because the women made us realize we need this. It might be a simple idea, but it is definitely serving them, and it's making an impact on their treatment, on their recovery, or for the women who don't recover, it helps them transition before they pass. We've seen so many women come through our doors, and I think that is what motivates us every single day. So we have dignity, and we are humble about it, but at the same time, we know that every dollar that comes there is going right back to these women, and they're grateful.
And the name of the name.
Right.
Where's it come from?
It comes from the Blessed Mother. And we have to say, from the very beginning, people said, are you a religious organization? We said, we're non-denominational. But for us, Mary is a woman she's humble, she's joyful, she had trust, but most of all, she loved. And that is the foundation of our mission, is to just love. We love women unconditionally. We don't judge them. Wherever they are, we meet them. And we say, you may not be able to walk through here, but we will carry you until you can. And that is what we do each and every day.
So it's 7 years, it'll be going on 8. What has this done for you?
Every morning I wake up grateful. Put my feet on the floor a little differently. I teach yoga. And fitness has been a part of my life, and wellness. And I don't take my health for granted. I try to instill everything and live each day like it's, not that it's like my last, but that it makes a difference. And this mission has changed the 4 children, the husband I have. I know it's changed Michele. It's changed those people that support the community as volunteers. It's made Ocean Grove really, I think, a better place. It is a healing mecca, and it is a community that's rallied and to support these women, because not only do we support the women, but we help those men, the caretakers.
It's changed your relationship?
Absolutely. And we couldn't do it without each other. And we have 2 very strong personalities, softer, harder here, and we work well together to make it happen each and every day. There are days that one of us may be more emotional than the other. Maybe we connect with a guest who we've lost, or maybe the situation in the dining room is just a bit too intense, and one will back up, the other one will go forward, and we seem to really be a great team.
You're an extraordinary team. You're very special women, and Mary's Place by the Sea is a godsend. The only place like this in the nation. Michele and Maria, thank you so much for being with us.
Thanks.
Keep doing what you're doing.
Thank you.
We'll be right back right after this.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD, and follow us on Twitter at Steve Adubato.
Hi, Steve Adubato. More importantly, this is the New Jersey Nurses Association, the EPIC Awards, and we're here with the CEO of the Nurses Association, Judith Schmidt. Judy, what are, in fact, the EPIC Awards?
The EPIC Awards are an award that we give as nurses to exceptional people in the community. We like to honor those non-nurses and some nurses who have gone out of their way to make sure that the community has the services that need in relation to health care and social services.
A whole range of people are being honored. Governor Tom Kean being honored, Dr. Ann Prisco from Felician, their great nursing program, and so many others that are being honored tonight. Let's talk about this. We've talked before on the air, on public television. You've been with us. But the role of nurses changed dramatically over the years. But advanced practice nurses, so important. Why? What are they and why important?
Well, advanced practice nurses are nurses who have attained minimally their master's degree. Most often they have doctoral degrees in nursing practice. They're also certified by a certifying body for advanced nursing. And they're able to independently assess, plan, implement, and prescribe medications and medical devices for their patients. They do, however, have to have a collaborating agreement with the physician to be able to.
What does that mean, a collaborating agreement? Explain that. For example.
They need to have a physician that they have a contract with, so if there is a patient who may have a complex condition in which they feel they would need some referral or maybe some consultant, they would be able to call this physician, email, get some information from that physician to help plan out the care for the patient.
How does that help the patient?
Well, what it does is it increases the number of providers that we have, especially in our underserved areas, such as in Newark, Camden, Paterson, Trenton, to be able to have more primary care providers available for our citizens. And then the physicians can focus on those more complex patients. So the nurses can focus on the wellness and maybe chronic disease management, and our physicians can focus on complex chronic disease management. So it's a great partnership between nursing and physicians to provide the needed services to our communities.
But also the other part of that, we've talked about it on public television an awful lot, and our partners at NJTV News talk about this as well, the primary physician shortage. Connect for us the primary physician shortage and what you just talked about.
Absolutely. Our understanding is that there will be a significant shortage of primary care providers for a number of reasons. A lot of the young men and women that go into medical school are now preferring to specialize in areas such as orthopedics, endocrinology, neurology. So there's not a lot of primary care physicians, or what we know as the old family docs that are out there. So this is where our advanced practice nurses come into play. They focus on primary care, taking care of the family, the individual, doing wellness checks, and also being able to manage their chronic disease such as hypertension, diabetes. And if they become more complex, then she would have a referral network, or he would have a referral network that they could refer to a physician who is maybe a cardiologist, a neurologist, an endocrine
specialist.
A specialist, absolutely.
Judy, has the Affordable Care Act several years ago passed, well, let me ask you this way. How has it changed the role of nurses and nursing?
I think it's opened the field for our advanced practice nurses to be out in the community and to be able to perform primary care services. There are now more patients who are on insurance plans, so that also helps with patients seeking care, because a lot of times our patients don't seek care because they don't have insurance, and they wind up in our emergency rooms at a really crisis time of their disease, and the cost to take care of that patient becomes exponentially more expensive. Whereas if we have our nurses and our insured patients together working in the community, maybe we could prevent that disease from becoming a more chronic, complex condition.
Which was the intent from the beginning, to deal on the wellness side. How about this? The State House down in Trenton. There are obviously 50 state houses across the country dealing with a whole range of issues. But the question is, in New Jersey, what initiatives, what efforts are going on that would potentially impact nurses, nursing, and the interaction with patients?
Well, we do have a consumer access to health care bill that's in both the states.
What does that mean?
What it is it's looking at that contract or the collaborating agreement to eliminate it so that nurses can more independently practice, so they can open up their own practices, not to have a strict contract with a certain physician that they could really refer or consult with any physician that they would like. So if a contracting physician wasn't available, oftentimes the nurse doesn't know or doesn't have a referral network. So it would be great if we could have that collaborating agreement removed. So that would open up more nurses to be able to do primary practice.
Devil's advocate, what happens if a physician or the physician community says, hey, wait a minute, a nurse, he or she may be great, but they need us to sign off on that so we know everything's playing out the right way? You say?
I'm saying that our nurses are educated, again, master's prepared, in a lot of cases, doctorate prepared now, so they are able to...
These are advanced practice nurses, I'm going to be clear.
These are not registered nurses who you see day-to-day in a nursing home or in a hospital setting. These are advanced practice nurses who are going beyond their registered nurse licensure and getting educated and certified to be able to take care of patients independently. Now, if there's no collaborating agreement, nurses are still going to say, if this is a complex case, I need to refer this to a specialist, or I need to consult with the specialist for the best plan of care for this patient.
So ultimately, being patient-centric, you're convinced that this will provide better care for patients?
Absolutely. I think with nurses involved in healthcare, especially in primary care, we're going to start to see a decrease in chronic disease issues and a slowing down of the progression of chronic disease. We need to focus on wellness. Wellness is the least expensive way to provide health care. When we have a chronic disease, you can see as we go on with a chronic disease that the cost of taking care of that patient really rises. We get primary care, healthcare providers, physicians, nurses, physician assistants into the community to help prevent that complex care.
You know, of all the years I've known you, Judy, I don't think I've ever asked you this question, but why did you go into nursing?
I went into nursing, number one, because I like to take care of people. I want to make sure that my community is healthy. I also, as I progressed in nursing and was educated in the different aspects of healthcare, I understood that nursing was there to help keep the costs of healthcare down, to provide the needed services in the community, especially in communities that are very underserved. Nurses go in because they care.
And the most rewarding part about the nursing profession for you?
For me right now is to care for the caregiver. My role as the Chief Executive Officer of the State Nurses Association is to now care for the nurses that care for the patients in our community.
They need that care.
They need that care, absolutely. Healthcare is becoming so complex. Patients' acuities are going so tremendously high, both in...
What does that mean?
Well, complex cases, more medications have to be given, more procedures are being done in hospitals, more treatments are required. Patients' plan of care is very complex, so our nurses at the bedside are struggling to keep up with what's going on in healthcare.
Last question. Nurses are leaders, no doubt. Therefore, greatest leadership lesson you've learned as a nursing professional is?
To listen to your patients. For me, as an executive, to listen to my nurses.
Well said. Thank you so much. Congratulations on a great night.
Thank you. Thank you.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, Holy Name Medical Center in Teaneck, New Jersey, Suez,
QUALCARE Inc.,
Choose New Jersey, NJ Best, and by New Jersey Sharing Network. Promotional support provided by the New Jersey Chamber of Commerce, the statewide voice of business in New Jersey.
and by bestofnj.com, covering all New Jersey has to offer.
Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
My name is Dr. John Rundback. I'm actually the medical director of the Interventional Institute here at Holy Name Medical Center. The peripheral arterial disease actually is extremely common. It's one of the forms of hardening of the artery. As interventional radiologists, we perform minimally invasive image-guided procedures. Generally, the procedures we do are alternatives to what would otherwise be major surgery. Almost 80% of those patients can avoid amputation if they're referred for us for these sort of procedures.
Holy Name Medical Center in Teaneck, New Jersey, 1-877-HOLY-NAME. Healing begins here.